I see ICRA as a great solution for some employers, but it's a big lift to transition from a group medical plan to an ICRA for HR and also for the employees. So from the quotes I've done with different providers, Remodel Health looks to really provide the most ongoing service to help with that lift, and they're unique in that.
So a couple of different reasons, and no real order. The first reason is that one of the big carriers in our area, Highmark, is a preferred partner with Remodel Health.
I think the people make a difference, the resources, and they seem like they're really investing. They're not trying to just stack technology and hope that it works.
I'd heard about ICRA a few years ago. I started researching some different vendors, and Remodel Health is the one I chose to work with because mainly they handhold our clients and their employees.
Yeah, I haven't had anyone really be, I guess, concerned that I'm just going to send them off to someone else. They know we're still going to be involved. But I think the white glove service is a big part of why they're comfortable in partnering together.
I think the biggest problem that we solve with our client is the post-ICRA implementation. It's consistently a concern or an issue when you have employees that are now much more responsible for their healthcare than they've ever had to be.
Cost is usually where it starts with ICRA. A client looking at a 20, 30, 40, I had a 125% increase on the most recent renewal cycle.
Yeah, so the most fresh memory of this is a client I put with Remodel Health January 1. This was a client that thought they wanted to go self-funded, but they only had 30% participation. So 1,000 employees, but 300 people enrolled. And poor participation leads to high risk. And so I thought, okay, let's pull the ICRA strategy out and let's talk to them about it. I didn't know if they'd go for it, but they ended up loving it. The CFO thought it was a great idea and got Remodel Health on the phone with them and helped us walk them through, how is this going to be different from group medical? How are we going to educate our employees? And basically it solved their problem of low participation and a 33% increase.
The biggest story that comes to mind is that we're working with a client right now that is evaluating this for 1/1. For 1/1/26, we started this process in January of 25. Remodel was one of the groups that we recommended that they talk to. And for them, they are a very engaged client. They have a very strict timeline that they're sticking to with this implementation. They are very involved in all aspects of not just the implementation, but the evaluation, the contract discussions and things like that. So having the fact that we recommended that they consider talking to Remodel made them feel much more comfortable. And it has allowed us to really follow that timeline for them. So they feel like the process that they've laid out is being followed very closely.
If we're not talking about ICRA, another broker's talking about ICRA. And we need to make sure our clients hear it from us first. And once they're comfortable with that concept, then it's a matter of finding the right partner.